Hi, my name is Dr. Abigail Collins, and I am a consultant in public health medicine. And I work with the HSE and have been working on the schools' responses and their return to education since last September, when schools returned for on-site learning. I'm here to talk a little bit today just about the return of special educational needs schools and the special educational classes into the schools for this coming term, and the safety for on-site learning. What it's really important to say is that we've been considering this for such a long time, since before the schools opened in September, and have been monitoring really carefully throughout the whole of the last term and working hard within the school settings when there have been cases of COVID-19. And what we've learned over that time period is that with the right mitigation measures in place and everyone taking their responsibilities really seriously about preventing COVID-19 and going into the school and being onwardly transmitted within the school setting, we can provide a safe setting for people to work, and most importantly for people to attend and receive the care and educational supports that they need for their future development. So over the last few months, what we've learned is, despite the very different levels of COVID-19 in the community, where we've had some real peaks, as in October and the end of December, and where we've had some low periods of COVID-19 in the community, we've seen very stable, low levels of onward transmission when we've gone into schools and done close contact testing amongst those most at risk of having been infected with COVID-19 from a case. That low level of around 3% has been very reassuring and very stable. So in terms of the mitigation measures that are in place, I suppose there's three big areas to consider. One is in stopping COVID-19 coming into the school setting or the special class setting. The second is making sure that we do everything correctly to stop any potential spread of COVID-19 within the school setting. And the third part is our role in public health, for us to make sure that we come in if there are any concerns about cases of COVID-19. As a whole nation, we have been asked to stay at home and limit our close contacts as much as possible. And it's because of the overriding importance of the face-to-face educational opportunities and health needs opportunities for children with special educational needs that it's been facilitated for these children to maintain their on-site education, which is fantastic, and that's a really important position for us to have as a society. But it does mean that we have to be very, very sure that everything else that we're doing as a family outside of that setting is as safe as possible and meets all those other measures. So it's really important that we do follow that guidance, that we do limit our social contacts, and that if any of us within the household setting have any symptoms which could be consistent with COVID-19, we contact the GP and everyone in the house stays at home. There will inevitably be cases where people were in school and they did turn out to be infectious within the school setting. And that's why all the measures recommended to be in place to mitigate the onward spread of COVID-19 are so important. These include things like respiratory hygiene, like the hand hygiene, like the social distancing, like the facial coverings. And it's really important that everyone, staff and students, as best possible, pay attention to those measures when they're coming to the school, when they're going into and out of the school, at break times within school, particularly important when we're talking with our colleagues and relaxing. Unfortunately, COVID-19 doesn't relax. So when we're still having our coffee breaks, etc., those measures are so important to be socially distanced and to keep up the hygiene. And obviously all of these need to be implemented as best possible and best practical, given the setting that we're in. And we acknowledge that some of those mitigation measures are more complex in some of these settings and with some pupils. But it's very important to consider how best they can be implemented, and to make sure where one area is more complicated, due diligence is taken with all the other areas to ensure those mitigation measures are in place and the right face coverings are being utilised at the right time, for example. It's also really important that, should you recognise or be concerned about any of your students that they aren't quite well, or well in the same way that you would be used to them being, even if they aren't able to express that you obviously act with the appropriate PPE and caution and allow those children to be returned to home and for their GPs to be contacted as necessary to investigate them. So there's a lot that we can do that we know works well in that setting to prevent the onward spread of COVID-19. The final part is our end, whereby when we have a case of COVID-19 or you have any concerns as a principal about cases of COVID-19, you contact the HSE principals line and discuss with us, and we will follow up and do the close contact investigations, the risk assessments, and organise any required testing as per normal. So on-site learning for special educational needs and special classes is going to be available for our children who so desperately need to avail of these opportunities for education and for healthcare and for their onward future development. But with that comes a real responsibility for us all as a community, as a school community, and as individual families to make sure that we keep that safe space. It is a safe space with all the right mitigating measures in place, and most importantly, are making sure that no one who has symptoms of any concern, either the pupils or staff members themselves or within their family settings, present to the school at this point in time.